This was a 61-year-old gentleman who had severe lower urinary tract symptoms and was suffering from side effects from medical therapy, specifically backwards ejaculation. He wanted to undergo the resume or steaming of the prostate procedure to preserve both erectile and ejaculatory function. Here we can see the initial cystoscopy highlighting the anatomy of the prostate, and the resume device allows us to measure the length of the prostate, which is what is being done here. Once we know the overall measurements, that allows me to calculate how many steam treatments are required in each lobe of the prostate. In this gentleman's case, his prostate was moderately enlarged and he needed 2 steam treatments in each side. Again, the positioning of the steam treatments is carefully and precisely located to 1 to 1.5 centimetres from the bladder neck, and here we can see the first steam treatment being performed. The needle will be fired into the adenoma or the enlarged prostate tissue, and once into the adenoma we can see the bubbling occurring as steam jets are put under pressure into the prostatic obstructing tissue. We can see blanching of the prostate tissue, already showing that it's had some effect. Further treatment is performed closer to the pelvic floor, and the same procedure is repeated on the opposite side of the prostate. This gentleman went home on the same day with a catheter in. He had that for the standard 5 days, following which he had a successful trial void. It was important for him to know that his waterworks initially would get worse as there's some swelling of the prostate, but after about 3 weeks they've returned to his initial baseline and continued to improve ever since. He now has normal erectile function, significantly improved waterworks, and normal forwards ejaculation. This procedure is useful for smaller prostates and specifically in men who want to preserve erectile and ejaculatory function. It requires a certain shape of the prostate as well, and not everyone will be able to have a resume procedure. All this will be clearly discussed in any consult prior to any surgical options. This is Dr. Martin Elmes. Thanks very much for listening.